Hello everyone, my name is Jacob Bryant. This presentation is going to be a skills presentation on how to manage bleeding using the available materials. For this one, we're going to be doing it in a camping or hiking setting, but this is, how to manage bleeding or hemorrhage in the military or natural disaster setting where you might not have your jump bag and ambulance and all the nice stuff to help take care of the patient. So let's get into it. So for this scenario, we're going to say that you're walking with your friends, you guys are all in your mid-20s, you're with your 25-year-old friend Bob right here, when he decided to walk and then he fell, and a tree that was really sharp went right into his arm here, and he started bleeding profusely. It kept on bleeding. You were seeing some dark and red blood. So first thing you want to do is recognize the resources around you. So we'll say that there's, obviously Bob right here, there's me, and then there's two other friends. And then at that point, you also want to think about the materials you have around you. So you want to think about all the resources you have. You want to think for bleeding like this, you want to have, some, whether it's shirts, padding, socks, it's not going to be a sterile environment, but, when you're in the middle of the woods, you got to do what you got to do with what you have. Next thing you want to do is you want to first have someone immediately go ahead and get a towel or something of that sort. Or we'll have this towel here. We're going to put direct pressure on this wound. So we're going to hold it. You're not going to be soft with it. You want to hold it pretty firmly. So we're holding direct pressure. At that point, you want to go ahead and call 911. You also want to see if there's an area, if the patient might need to be airlifted. Maybe you're 3 miles into the woods and there's no way for an ATV, a vehicle, or any EMS to get there. At that point, you might want to find an area where the patient could be airlifted out. Someone's holding very firm direct pressure. You do also want to go ahead, obviously Mr. Bob here is not going to be hiking naked. So you want to go ahead and so at least, let's say he has a jacket on, to at least expose the wound. So we'll take some trauma shears, but in the camping setting, you might not have that. So maybe you have a knife, maybe you have, like I said, a pocket knife. You might have just regular scissors. You're gonna have to do with the available materials you have. So we'll just go ahead and cut around. Now, if there is, let's say, like we said, he fell, a really sharp tree got into him and he started bleeding profusely. Let's say a part of that branch is still in the arm, we are not going to remove that. The reason being, if we remove that branch, that could lead to bleeding that we are just unable to control by any means. It also is giving a higher chance of infection because there's so much open area now for all the bacteria and everything else to go in. And when we have a patient like this where we don't have a very sterile setting, we want to try to keep this patient as clean as possible. Now, as I was saying, we want to, make this as clean as possible. We're not going to have the perfect sterile setting, but we want to do what we can. So, we want to go ahead and try to have clean towels and linens and whatever we can find to put pressure on here. We also, if we have a water bottle or something like that, we might want to just, quickly, maybe if we're changing linens, if direct pressure still isn't working too great, but we'll keep on trying, might want to take it out. You got the wound right here. Obviously, this is not a water bottle. This is what I got. You just want to take it and then squirt on it. Kind of clean it out, rinse it out. Like I said, we're not taking any branches or anything else that might be stuck inside, but maybe we can flush out some dirt, bugs, anything like that. It's definitely will be helpful. For this patient, we want to try to control the hemorrhage, but we also want to check out, the ABCs as if it was a regular EMS call. So obviously, we also want to make sure that patient is alert and oriented. So, hey Bob, can you hear me? He says, yeah, I don't feel good. So, we're looking at him, talking to him. We want to ensure that the airway is open and patent. We also want to, check his breathing. Obviously, most people on camping trips, they don't have stethoscopes with them. So, what we can do, Bob's our friend, we're all hiking, you got to do what you got to do in situations like this, is we can first just kind of look at his chest and check his breathing. Try to see how many times a minute he is breathing. Normally, when people have a traumatic injury like this, especially something as serious as this, where the hemorrhaging is not being controlled with direct pressure, there's a good chance he's breathing a little bit heavy. So he might be breathing, 28, 30 times a minute. Um, we also want to check and listen to the breathing. Maybe he has some wheezing going on. He also might be allergic to the branch or the leaf that was in that, punctured him. Maybe it was a big tree that had some poison ivy. So we want to just take our chest or head right here and try to listen to the lung sounds. And you want to try to do it on each side. Obviously this is going to be you with a bunch of friends. You do what you can. If you're by yourself, you do not want to let go of that pressure. So even though it'd be important to get all these vital signs, the most important thing is to make sure that the patient is not bleeding out of that arm. The next thing you can do is you want to check a pulse on each side. If they're bleeding really fast, there's a chance that it could be rapid and weak. It might not even be present because it's so fast and there's so much blood coming out. So it's important to check the radial pulse if you can on each side. Obviously, like I said, there's going to be more of a divide and conquer kind of thing, as someone does need to keep holding on to the arm at all times. So it is important to see the radial pulse on each arm. You can also look at the pedal pulse on each feet. If you're unable to, get the pulse greatly. Also on the affected extremity, along with one that is not affected, it's important to check your pulse motor sensory. So like I said, you want to feel the pulse here. Okay, we do feel the pulse. Hey Bob, can you wiggle your fingers? He is able to wiggle his fingers. And then Bob, can you feel me touching your hand? He does. So therefore, he does, PMS is intact, even though the bleeding is pretty severe. So you do still want to go through your ABCs. You still do want to make sure Bob is alert and oriented. Obviously, patients with uncontrolled hemorrhage, they're, really likely to go into shock. So it's important to try to take care of this soon, fast, and to watch for the signs of shock, because, you want to try to keep them not into shock as long as you can. So then another important thing, obviously we have Bob sitting down right here, but whenever this injury happens, it's important to, get this patient sitting down or laying down somewhere. Right now we'll have him sitting down. It's also important, if you are looking like you're either gonna have to go by ATV or EMS or airlift, to kind of have the patient prepared for extrication. If this patient is severe, he's gonna have to go by EMS, probably wouldn't be the best idea to put him, in a little corner or tell him to go into his tent or something like that. So you still want to keep on doing the direct pressure. Let's say we're doing direct pressure, we're looking at the bandage, it's soaked in blood, that's the reason why it's red. Then you can keep on going to the other bandages you have. I said divide and conquer kind of thing. So we'll say we had a towel we were going to use, kind of like a kitchen cloth that we were going to use for cooking. We try to tie a little knot into it right here. And then at this point, we're still having someone hold pressure, and this is going to be very direct, firm pressure. You're not just doing a handshake, like you were trying to squeeze his arm off, basically. So you want to go ahead, take this, if you can, tie a little knot into it. And upon changing it, you want to put it into the wound that we have here, and you want to pack it, and you just want to keep on packing it. Try to get as much of that towel or whatever into that wound. Like I said, this is not going to be the most sterile thing ever, but you got to do what you got to do. Then you can take another towel, whether it's like a bath towel or a sock that maybe you were able to unravel or your friend was able to unravel, and you just want to kind of cover it up. So we have that towel, or that towel that we were able to pack into the wound, and we're packing this in pretty freaking tight. And we just want to cover it up. Like I said, by this time, whether 911 was called or there are park rangers nearby, the idea of what you're doing for extrication should be known by now. So we just want to keep on wrapping it. Like I said, we're trying to get the direct pressure. We're trying to limit the amount of space that the blood can kind of creep out of into this wound. And from there, we can also go ahead and put another towel on it, keep on holding that direct pressure. And like I said, we are holding this tight. So we have the towel packed into the wound, and we wrap something around to try to keep that packed towel in there, and then we put another towel if possible, and we're holding firm direct pressure onto the wound. Now that we have the bandage kind of stuffed in there, wrapped up, and with another bandage holding direct pressure, if possible, whether, you know, if there's a tree, you might be able to have them kind of lean the hand on there. You could also, you know, tie it there, or, you know, if you have someone that's just not really able to help at all, you could have them just hold the arm up. So you want to at least try to hold the arm above the heart here. Reason being, obviously, for blood to pump to the arm, it's going to take a lot more effort out of the body to pump it upwards due to gravity compared to if it's below the heart. It's just going to kind of slide down there. So we got it right here. Let's say we're doing all this though, and this bleeding is still going on. It's still very serious. You're still getting the dark and some bright, you know, again, that bright red blood, again, the venous and arterial bleeding. You know, we're trying pressure. We did everything we can pressure-wise. We tried packing it. At this point, we are probably going to have to go towards a tourniquet. Obviously, if you're camping, you know, EMS or not, chances are you don't have a tourniquet, you know, handy on you due to them being expensive, due to, you know, you think you're just going there for a camping trip. You don't think you're going to have to actually, you know, do your job. Some people do, but most don't. So one thing you can do, you can find, you know, a stick. You know, you do want to make sure it's a sturdy stick. You know, this is a piece of driftwood. And then you can take a shirt, t-shirt, you know, pillowcase, whatever linen you can find that you're able to wrap around the arm a good couple times without it being, you know, you don't want it to be like a super kind of thin rope size. You want it to be a little thick, kind of more around this range. You never want to apply it onto the wound. You never want to apply it over the joint. And once you put it on, you cannot take it off. So, well, you know, first we'll explain to Bob, and we'll tell him, like, you know, if we're gonna be, you know, we don't want you to go into shock. We don't want you to die. You're our friend, so we are gonna have to put this tourniquet on you. Said you want to do about 2 or 3 inches above the wound, not over a joint. So, you know, like I said, we had the wound right here. We'll go ahead and do it here, right below the joint. So what you want to do first, and, you know, obviously we'll have it above his heart, just for putting the tourniquet on. Where I'm going to do it below, just to make it a little bit easier. So you want to go ahead and do one simple knot, just like that. Now, that is not your tourniquet, but this is the start. You want to go ahead and take your stick or anything long, you know, long and firm. So you could use a flashlight, you know, you use flashlight, a pair of scissors if you have them. So we'll go ahead and just do another very simple knot. Just like that. So all we did is we put one knot to secure it, another one over it. So now we have the stick right here, and all you're gonna do is you're just gonna twist it, twist it, twist it. Like I said, that's why it's very important to have something firm and strong that won't break, because you do not want it to break on you, obviously, and it's gonna get a decent amount of tension. So you wanna do it until the bleeding stops. You also do not wanna feel a pulse, so it's important to check, you know, depending on the extremity, you know, it's important to check that that radial pulse for this arm. Obviously has the wound in the right arm, so we're gonna check the right radial pulse. We got it right here, we got it pretty tight. And then we're just gonna kind of secure this stick here to make sure it doesn't go anywhere, because once you tighten up a tourniquet, you never wanna loosen it. Now, if the patient does start bleeding again, if the radial pulse ends up being present again, then you, by all means, you wanna go ahead and try tightening it again. But you just wanna kind of wrap this up here. You can do another knot, but the important thing is that this stick is not going anywhere. You know, this is not gonna be a pretty thing, you know, this is not gonna be the tourniquet from the store, same thing with the bandages and everything, but this is, you know, a life or death situation. You don't want your friend Bob here to go into shock. You don't want him to bleed out. You know, when you're camping, when you're out, you know, somewhere where not a lot of people are, there's a good chance it's gonna take a long time for EMS or a helicopter to get there. So you wanna do everything you can to kind of help Bob out. Now, throughout this, you still wanna talk to him. Obviously, he's lost a lot of blood, so you still wanna make sure he's alert to you. Would be good to check a GCS score, make sure, you know, he's not having any confused conversations, he's still able to obey commands, he's still looking at you upon, you know, when you talk or just spontaneously. But yeah, so we had the packed wound, and you know, we went ahead, that still wasn't working even with the super direct pressure. We went ahead and did a tourniquet here, and that stopped the bleeding. It's important then to go ahead and note, you know, you can take a marker and write it on him or write it on the tourniquet. You know, the tourniquet I have here, it'd probably be better to write it on him, and you want to write what time you put that tourniquet on. Because when he goes to the hospital, you might not be able to be there if it's airlift, or EMS might forget. You know, a lot of things can happen during severe trauma, so it's important that you write down somewhere on him or near him that's on him that shows what time that tourniquet was applied, so they know exactly when this arm started losing circulation. So after you apply the tourniquet, like I said, do want to mark right here. I just put TQ at 1300. It's 1 o'clock right now, so that's when we put the tourniquet on. This point, we still want to keep this arm raised above the heart. Even though the bleeding has stopped, it is important to do everything you can not to start the bleeding again. Another thing you could do right now, like I said, if you're with a group of people, one of your friends could kind of help Bob here by hydrating him. Obviously, with shock, with the amount of blood he lost, it's important to kind of, give him some water if he can. You do want to be careful on how much water you give him, though. You don't want to give him more than 2 liters because you don't want to have a chance of disrupting the clotting cascade and having the bleeding start more and you having to continue to tighten the tourniquet. At this point, after they're given water, you could go ahead and just do a rapid trauma assessment. At this point, like I said, you should know when EMS are going to get there, or at least understand how they're going to get there. If they are going by airlift, it's important to have an area ready. You kind of want to work on, again, having them ready for extrication. At this point, you just want to check, see if he hit his head anywhere upon the branch. Whenever it happened, a lot of stuff could happen. Maybe he torqued his leg. So, we're just going to do a rapid trauma assessment real quick. Check his head for any decap BTLS, any fluids coming from the eyes, ears, nose, or mouth. Make sure the neck's intact. No JVD, no tracheal deviation. Make sure the collarbone's intact. Kind of keep on going down. Equal chest rise and fall. Check each arm. Check PMS. Obviously on this arm, should not have a pulse on that arm. This arm you should have PMS intact. Check the abdominal area. Make sure there's no, severe bruising. Check for priapism. You want to make sure there's, that's a high indicator of a head injury. So even though you check, even though you talk to them, you do want to check that just to be sure. Then you just want to go down the legs, same very quickly, and then check PMS on both legs. Make sure that pulse motor sensor is intact. And it's important to have someone, if you're not doing it, have someone note all this stuff, just because then you could give it to EMS or give it to airlift. So we gave the water to combat hypovolemia and shock. Now we might try to, we have the patient stable, the bleeding is stopped, we have the tourniquet noted. We want to first, reassess all the vitals, see if his heart rate's going down or up. Obviously you want to check that on the arm or carotid that is not, is not tourniquet. You don't want to check that right radial, so you want to check the carotid artery or the radial or the pedal pulse. Like I said, still a good chance it'll be elevated because, you just tourniqueted his arm. That probably hurt a lot. You might want to talk to him, see how he's feeling. Obviously, he's probably not doing too great because, just put the tourniquet on his arm. So then you want to try to note down some history. Ask him if he has any clotting disorders. He ever had a history of DIC, which caused him to clot too much or not clot enough. It's important to ask if he's on any anticoagulants like Eliquis or warfarin. Also, like I said, it's important to ask about beta blockers too, because if he's on a beta blocker, obviously his heart rate and blood pressure will be kind of limited or maxed out at a certain point, so he will have difficulty compensating. Also important to ask about hypertension or hypotension. You know, we're not going to be able to get a great grasp at what his blood pressure is right now. Obviously, we can check if we can feel his radial pulse. Usually that means his blood pressure is over 80 systolic, but it's still important to note down, you know, any history you can find. So let's say the only history he has is his anxiety. We'll say no blood thinners. We'll say no beta blockers. Say he takes a Zyrtec, even though that is not super pertinent. We'll go ahead and put tourniquet applied at 1 o'clock or 1300. We're also going to say how many bloody bandages we ran through. So for the sake of this, we'll say that we ran through 3 bloody bandages. And we can show him the size. That just gives him a grasp of how much blood he's already lost. Also, if we gave him a decent amount of water, we can say that. So we'll go ahead and say that we gave him 1 liter of water. So given this, we'll just allow EMS to have a little reference. Obviously, when they see him, there's a good chance they're going to pick him up and go as fast as they can, just because the tourniquet's on. You know, it's going to be a long time for them to get back to the ambulance or get to the hospital via airlift. So time is everything. Another thing you can do while waiting for EMS to come is you can go ahead and get this patient trauma naked. So you know, go ahead and take off everything. I know Bob's just a friend here, but you know, you gotta explain to him you're doing the best thing for him. You want to be okay. You could also start directing him to lay down, you know, keeping that arm raised just to kind of help prevent shock from happening at all, keep his body as relaxed as possible. So we'll go ahead and lay him down. Now we got Mr. Bob laid down. We got him in a supine position. Like I said, still want to keep this arm raised up. We want to do everything in our power to make sure this arm does not begin to hemorrhage again. So what we're gonna do now is we're just gonna go through all his stuff. Obviously, I know his stuff might be expensive. He might complain about it, but you know, we gotta get him completely open so they're able to see everything going on. So we'll go ahead and just, we'll say cut through the shirt, cut through the arms, you know, and go ahead and cut through the pants, all the way through, you know. Upon us cutting through everything, you know, we want to go ahead and just do a really quick trauma assessment again, do a little head to toe, just like we did before. Check the head, look for any fluid, decap BTLS, see if we feel any deformities. Then going down to the chest, same thing, checking for equal chest rise and fall, make sure the collarbone's intact, checking for tracheal deviation or JVD, checking for any decap BTLS of each arm. Obviously, we have the laceration right here. You know, checking the abdomen, you want to make sure we don't have any tenderness or pain upon palpation. So let's do a quick film there. You say it doesn't have any pain. I'll make sure the pelvis is intact. Let me adjust it. Make sure the pelvis is intact. Check for priapism. You know, maybe just a little drift. You don't have to full and grab it. Then we want to hold the legs here. Decap BTLS of the legs. We don't see anything. Then check PMS of the pedal. The feet. So check PMS, pedal pulse. Make sure everything's intact. Make sure you can wiggle his toes. Make sure he feels you touching it. So at that point, we got him trauma naked. We did a trauma assessment. We did our head to toe. Now we want to go ahead and get him all warmed up. So even though we did take off all his clothes, it is important to try to keep him as warm as possible. When a patient's going through hypovolemia and blood loss, there is a high chance that they do become hypothermic. So we want to do everything we can to try to keep him warm, even if it is a hot day, you know, cover him up. If it is winter time when you're hiking, there is a chance that you might have some hand warmers. So maybe even then you could place some hand warmers in the groin area, put it in the armpits, you know, put it near his head, just kind of keep him as warm as possible. So just to recap, got him trauma naked, did a head to toe trauma assessment, didn't find anything else besides this laceration that has been tourniqueted. Obviously he does not have pulse on that right radial arm or right radial pulse. and we went ahead and warmed him up. We put a blanket over him, and we're just gonna now wait for EMS. So now we have Mr. Bob on the floor. We're just gonna go over everything that we're gonna tell EMS. So first thing to tell him is we'll go ahead and say that, you know, this injury happened at 12:45. He had a sharp branch go into his arm when he started bleeding. We tried direct pressure. He went through 3 bloody bandages. We'll say he does have a bandage currently packed into the wound that is being wrapped up right now. At 1300, we did apply the tourniquet. Bleeding did stop. We'll let him know we did not have to re-tighten it at all. We'll say that he doesn't take any blood thinners, no beta blockers, just the standard anti-allergy medication Zyrtec. Does have a history of anxiety, has been doing good with us so far. We'll tell him we gave him a liter of water. Say vital-wise, his radial pulse is intact of that in the left radial. We'll say that his heart rate of about 120 beats per minute, respiratory rate 28 times per minute. We'll say we'll see equal chest rise and fall with no wheezing or any other lung sounds besides clear lung sounds being heard upon listening to. At that time, we'll give them all the information we have. They might have some extra questions. Obviously say we don't see anything upon our head to toe. They might find something else, but you just want to give them all the information that we have, give them the condition he's in. And at that point, you know, maybe you can help. They might want your help if you are ALS certified. You know, some people they don't. Some people they just want you to back away. What you want to do is to help EMS, you know, the airlift team as much as possible by doing exactly what they says. Because even if you know what you're doing, if you're right there next to them, that could just prolong your friend Bob's, you know, rescue or extrication, which, you know, minutes are everything. You want to try to get him in and out as soon as possible.